Hi guys, welcome back to my YouTube channel. It's Red Tech, and today we're going to be talking about CT scan preparations. So your specialist has asked you to go and do a CT scan. You have a letter with you, a requisition letter. That's the most important thing to have. We can't do the scan. We can't do the scan for you without this letter from a specialist. The letter could also be from a GP, but you're going to have to pay cash. Medical aid does not cover you if you consulted with a GP and they're requesting a CT scan. Only specialists can request a scan for medical aid. Okay, cool. So requisition letter, that's what you need. You also need manners. I'm kidding. You need to make a booking. Most radiology departments require you to make a booking before you come in. If you go there without a booking, then you can be a fit-in, but you're going to wait for long. Could be like 40 to 2 hours sometimes. It depends on how busy the radiology practice usually is. So yeah, you need a letter. You need to call to make a booking, or you can make the booking in person. It's much better that way because you can ask as many questions you like, and you'll be given anything necessary that you need before the day of the scan. Cool. So after making the booking, they will find out what kind of a scan your doctor has requested for you. And then from then on, if you're old, maybe over 60, or you're a cancer patient, or maybe the hospital that you went to, or the radiology practice that you went to requires you to do bloods to check your kidney function. So they usually ask you to do kidney function if your scan is a contrast scan. Remember contrast? Yeah, so contrast is a body dye that they inject you with, or sometimes you just drink. Sometimes you drink and they inject you. It depends on the scan, really. You usually need to do your bloods first before the scan. That requires you to be injected with iodine. Iodine is the body dye, which is also called the contrast. Okay, you need to make an authorization with your medical aid. If you're paying cash, if you are from a GP, unfortunately your scan won't be authorized, like for real. It's no joke. So you need authorization. You need to call your medical aid, tell them the kind of scan that you're having, give them the codes. You're going to get all those codes from the person that you booked your scan with in the radiology department. Yeah. Okay, so you get your authorization. Then you also need to go collect contrast if needs be. So when you make a booking, they'll ask you all necessary questions to know what you will need on the day of the scan. So sometimes, especially for abdominal scans, actually only for abdominal scans in CT, you need to drink contrast. No. You can drink contrast for, let's say, a chest, because the oral contrast helps us see your stomach and intestines much better compared to like when there is no contrast at all. Or yeah, so that's what oral contrast is for in CT scan. Okay, yes. And then when you go and make an appointment in person, they'll give you that, and then you'll bring it on the day of the scan. And then if not, you'll need to come in the day before the scan, or any other day, maybe within a week before your scan, to collect that contrast and have it with you. That's if you need the oral contrast, guys. Don't go there and tell them, Utsikho said I need to collect contrast. You're gonna make my colleagues hate me. And like different departments do stuff differently. Some departments hardly use oral contrast, for example. Yeah. And then number 5, you are going to need, oh sorry, I forgot the form for bloods. Sometimes if your doctor did not give you a form for bloods, then you will need to come to the department, collect the form. That's if you are very far from your referring doctor, your specialist. Yeah, and then that's all. That's before the day of the scan. On the day of the scan, you bring your required documents. They will tell you on the day of the booking, like on the day that you book, you need to bring this and this and this, and then yeah, you need to bring your documents, including the referral letter. Without this letter, you can't do anything. You also need your contrast, but you don't have to physically bring it. You need to drink it on the day of the scan if the doctor has asked for it, or if it's necessary for you to drink the contrast before the scan. Okay, you need to bring your authorization number. I guess you would have called your medical aid and they would have given you the authorization number, or you would have communicated with your insurance people and they would have given you a letter of guarantee, you know. Yeah. And then what else are you gonna need? You need comfortable clothing. Don't wear anything metallic, please. Just your sweatpants, and then your sports bra, your simple t-shirt, jersey, because city rooms are usually cold. I've worked in city for so long, but I still wear my jersey till this day when there's sun outside. So just bring your jersey without anything metallic. Okay, some departments are very strict. They don't even want these things over here. You know, when you have a hoodie and then it's got these metallic things over here, they don't want that. So just make sure that your jersey is just plain and simple. It covers your arms and it's not too tight, because if it's too tight and you need to inject you, then you're gonna have to take it off. I think that's it, right? So on the day of the scan, it doesn't matter what kind of a scan you're having. As long as it's a CT scan, you're gonna have to lie on a bed. Here's a picture of the CT scan. I would have posted it here. Okay, yeah, there's the picture. You'll be lying down there like that lady on the picture. I'll be that guy in a blue shirt telling you it's all gonna be okay, giving you instructions. If it's a brain scan, you don't have to get any breathing instructions, and your scan is gonna be like 5 minutes or less. How cool is that? Yeah, that's a CT scan for you. If it's brain or sinuses without contrast, then it might be for 5 minutes. And if it's with contrast, then maybe 15 minutes. You also need to have good veins. That also determines how long you have the scan. Because if you're struggling to find a vein, then that might prolong the scan. What else? Yeah, just bring your veins to be safe. You're gonna lay down there, you go in and out, and then that's it really. Okay, so if you get injected with iodine, you will feel funny during the injection. During the injection you'll feel like you're urinating, you'll taste something metallic, you will get hot flashes all over your body, and those are normal. It's not like you are reacting to something, you know. It's not an allergic reaction. And also you need to make sure, this was supposed to be number 1, you need to make sure that you're not allergic to shellfish or iodine. Sometimes there's a little bit of iodine in shellfish, so that's why we usually ask if people are allergic to shellfish before a CT scan that requires injection or oral contrast. Okay, so yeah, if maybe it's an abdominal scan and then you have drank your contrast, we're gonna need to inject you. The scan might be plus minus 20 minutes if you have good veins. If you have good veins, the scan might be 20 minutes because there's a delay scan that we need. We're gonna wait for like 7 to 10 minutes in between the scans. Yeah. So I think that's all about it, you know. Comfy clothing, and you don't have to always have like non-metal clothes in your body. Like, you don't know, It's only for abdominal or chest, but if it's brain, then you just need to remove your earrings and your wig because it's got clips, metallic clips inside, so you might need to remove your wig for your brain skin. But for abdomen, chest and whatnot, we just check from here down to the pelvic area. That's it. And then for the head and neck, no necklaces, no earrings, no artifacts. We call them artifacts in the radiology department, so you don't need to have any of those things. No wigs, no clip-ons, nothing on your head. So this is the end of preparations for CT scan. Thank you so much for watching. Till we meet next time. Bye.